Hey everyone, I'm Michael Uriarte or Dr. Mike, and welcome to Technique Talk, the MYK System and More. This is episode 46 in our series, and today we're going to interview Sara Nelson about the Dr. Vodder method of lymphatic drainage. Today we're going to cover information from Dr. Vodder's background, how his time spent drawing maps for a nautical archive helped him map the lymphatic system. We talk about the Vodder School International, how lymphatic drainage works. She gives a detailed explanation of each class and a treatment protocol. The Vodder method of lymphatic drainage. Have we got some good information in this video? If you want more information about the Vodder method of lymphatic drainage, I have the website links in the description below. If you haven't subscribed, be sure and hit the subscribe button, hit the like button, share the video. I have a lot more videos coming. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. All right, Sara. So let me know what kind of got you interested in healthcare.
In healthcare. I love that you asked this question. I'm like, oh, somebody cares about me. I feel cared. But I actually was an aerobic instructor and I was very interested in health. And I took this class called Health, Fitness, and Lifestyle Management. And that's where I got a hold of a College of Health at the University of Utah and degrees and what you could do with them. And I saw that if I finished this degree of health, fitness, and lifestyle management, I could be an aerobics instructor.
Nice.
and, and then I saw the physical therapy curriculum and I met some people who were in the program and I'm like, well, I like this. I'm gonna pursue this. I have a dance background and I love movement, and that just seemed to be the thing to do. I was looking at how I could support myself if I needed to. So that's how I got into physical therapy.
And so
I,
this was year wise. What?
oh my gosh. Well, I graduated from PT school in 1990.
Okay.
So
Okay.
I did my life backwards. I got an MRS degree. Remember those?
MRS.
Mrs. degrees, right? I went to the University of Wisconsin. I met my husband. I got married and I had kids. And then at some point I woke up and I'm like, I know how to waitress. What would I do if something happened to my husband? I got to figure out how I would support my family. And so that got me going back to school. My parents were really big on you need to go to college, um, and so that was always at the back of my mind. And
Okay.
yeah,
Okay. So in the 90s, and so
yeah, back in the 90s, in the
and in the
1900s.
1900s, that's what I say all the time too. I graduated in the 1900s. That's right. That's right. And so that got you into physical therapy. And we were talking earlier about, so when you graduated, it was just a master's degree. Is that
Oh,
correct?
it was a bachelor's degree.
Bachelor's degree, but it
Mhm.
wasn't a doctorate yet.
No.
The
Um,
doctorate came a little
and
bit later.
Oh, this is a good part of the story. So I did some of my, you have to do some hours of training to qualify for school. I got into the University of Utah. So I worked at Westwood Physical Therapy, which was Rick Hobush, who is one of the instructors for the Ola Grimsby Institute. He was one of the very first manual therapists here in the United States, and I got to work with him.
Wow.
And then he hired me and I went through their program. That was my master. So I have a master's in orthopedic manual therapy from the Grimsby Institute. And there, they really emphasized like osteopathic techniques, especially, like peripheral joint manipulation and six-dimensional locking techniques, for spinal manipulation. I didn't go on to the spinal manipulation. I am a I like cross-country skiing. I am not a downhill skier. I like it slow. If I want anyone to manipulate it, I'll just send them to my chiropractor friend, you know?
Right. Yeah.
So, but the level of training I got right out the gate was so wonderful. I'm very grateful to Rick Hobush for that. That was the first couple of years of my job was working with him and training with him. So I learned a really high standard right off the bat.
Very good. Very
Hmm.
good. And so that was you graduated from PT school and then got to work with Rick.
Rick.
Yeah.
And
Okay.
then I helped a friend start his own clinic,
Oh,
or he
okay.
was starting a clinic with a group. And that's where I learned marketing because they told me, oh, we're going to put you in this clinic and you're just going to get referrals. I got no referrals. And so I had to learn to go out and get people to come in and I built the clinic at that time. And then because then my name
Let
became
me
Dirt.
let me ask you real quick because this is the part that a lot of people when they first get out, the way that I was taught in school, hey, when you get out, hang your shingle up on the building, say, "Here I am," and people will come. And I remember I sat there for months. I sat there and was just twiddling my thumbs, and I'm like, "Well,
Where are they?
nobody's coming in." And so then you have to go out on your own
Hmm.
and start talking to people and start putting yourself out there and
Hmm.
that could be different today because of the social media and all of that kind of stuff, but back in before the internet, back when you and I were starting,
Yeah.
it was a different game back then. You had to get out of the office to go drum up business. So that was
Hmm.
yeah.
That was it. Also, in physical therapy school, someone, they had therapists come in and teach. And so they had a hand therapist come in, a certified hand therapist, treating hand problems. And she said, this is really a specialty. You need to train more if you're going to do it. And I was so cocky and arrogant. I was like, I can do that. So I started training to do hand therapy. And while I was developing that clinic, I became a certified hand therapist. And I carried that certification for 15 years.
Oh,
And
nice.
yeah, yeah. And that's how I got hired to where I am. I went looking for a job. We had 3 kids. And I had told my husband I need your help with these boys. They're getting to be teenagers and I I need help with them. How about I work and you stay home? So we went looking for um somewhere to go and we ended up where I am. Like the recruiter called and said, I got a job for you in Pasco, Washington. And we are like, what? Never heard of it. Um, and we interviewed up here, and it's like, wow, we could live here. I had never been to Washington. I was living in Utah at the time. I grew up in Madison, Wisconsin. Um, so we moved up here. I worked for the hospital for about 3 years. And in that time, there was some shifts in Medicare, and that was a period in which they were laying off um, physical therapists. And also I was doing really good work. I actually heard my employer refer to me as the cash cow.
That's good. That's
Well, anyway, so
you're bringing
feeling
in business. You're bringing
bringing in business and also treating hands, and that's where I ran into manual lymph drainage. So, because swollen hands are such a problem. And there was, a, so I'm so fascinated about the sociology of medicine. And the longer I practice, the more you can see the influence of society on how we practice medicine and what we believe about it. So, for instance, there's these two volumes of the rehabilitation of the hand. They're giant and they're referred to as the Bible of hand therapy. So, the class I taught was called Manual Edema Mobilization. And this woman had made up her own technique. And that when they put out the new edition of the handbook, she wrote the chapter on lymphatic drainage. Now, when I tell you the history of lymphatic drainage, um, that was probably not an optimal choice. That is not giving people frontline information or on the lymphatic system and how we optimize lymphatic function. So, but I took her course and I was interested. It got me interested, and then I started looking at where's the best place to learn this, and that's where I found the Dr. Vodder School.
And where is the Dr. Vodder School?
The Dr. Vodder School, well, the mothership is in Volksee, Austria, at the Wittlinger Clinic. So the Vodder School of the Dr. Vodder School International is in Canada. Um,
Okay. Okay.
it it is owned by Grace Didinsky. It was started by Robert Harris, and he sold it to Grace in 2020, in February 2020.
Oh, right before. Yeah.
Oh, and so that just squished the school in the United States. And it got quiet in Canada too. But this, she oversees classes in Canada, the US, South Korea, Hong Kong. China is interested, anywhere outside of Europe. So when Dr. Vodder School started, it was very much recognizing the entrepreneurial nature of teachers and having autonomy, whereas some of these curriculums, you just answer to that school. They gave a lot of freedom. So when Grace bought it, uh, a couple of the U.S. teachers said, "We're just going to do our own thing. We don't want to we don't want to work with the school anymore." And so so we were down to Kathy Fleming, who is a treasure. I refer to these teachers as treasures because so Dr. Vodder came up with the technique, and at some point I'll explain to you how he did that. Hildegard Wittlinger and her husband um, trained and taught with Dr. Vodder. Her husband died, and Hildegard carried it on. So I've trained with Hildegard. Kathy has trained extensively with Hildegard. So has Grace. So we're touching history,
Right.
and
Yeah.
carrying on this tradition. And uh, so let's see. The question is, where is the school? So that then, the school is in the Hilton Hotel, right? Right? It's in Grace's home office, and then um
She goes
she
out and teaches.
she runs it. So when they were looking at when Robert was ready to retire, and I said, you need to go talk to Grace, because I watched Grace help my friend um develop his teaching. She is such a consummate organizer and such a kind person, high integrity, a great person. And that's also why I'm like, I want to work for her. So since 2020, she has tripled the size of the classes in Canada.
Nice.
Yeah. So we're seeing this resurrection of this method, which is wonderful because I want to see it carried on. It is a treasure. It truly is. Um,
So Dr. Vodder, and how do you say his first name?
Emil,
Emil. Okay, Emil.
yeah.
So he came up with this, and this was years ago.
Uh-huh. Okay, so I got my notes. I was like, okay. Um, so to say a little bit about like maybe this is the place to put it. Um, I started teaching for the Dr. Vodder School in 2014, teaching the medical theory. Up until that point, everyone they had teaching medical theory was a medical doctor. I was the first doctor of physical therapy to do that.
Okay. Okay.
And by the way, I got a transitional doctor degree from Pacific University, and my project was a course I developed called Managing the Difficult Patient. And it was based on all the patients I was getting after I was trained in lymphatic drainage. Like their lymphatic drainage um, is good for so many mysterious illnesses. And um, so it just stretched me. I saw things that I had not been prepared for. Um, so in any case, let's see. That was um, so that's where I started teaching. Then because I had my DPT, they said, Sarah, would you teach this medical theory? So I have done that now for over 10 years, which is just a great way to really learn for myself because I have to be able to explain everything, answer any question.
Exactly. Exactly.
And, and then, so I have like at various times, I've had anywhere from 4 to 8 therapists in my clinic that are trained and certified in lymphatic drainage. And when the school hit 2020, I started asking them, hey, who wants to teach the practical portion? And everybody has reasons why they can't right now in their life. And so finally, a couple of years ago, I said, that's it. I'm going to do it because it's dying in the United States. Properly teaching this technique is floundering in the US. I'm sorry to say we like to sell it fast and cheap here. And and that's not been the Dr. Vodder method. So I said I wanted to teach level 1 and they said fine, you start training to do that, which I think speaks to the standard of this school. Even though you'd think, oh, Sarah should get a pass because she's been teaching this theory all this time. And they're like, no. So I still had to assist in 5 classes and then I had to pass a practical test to demonstrate that I knew that the techniques and the sequences. And so now I've started to teach the level
which
1.
which I think is important to make sure that all um it gets passed on properly, right? You have to
Oh,
go through,
amen.
the channels. Yes. Yes.
So one of the I also had to ask myself, well, does it need to be taught this way? So the way that the Vodder, okay, so let's go back and talk about Dr. Vodder and
Sure.
how he got here. Okay, so he was born in like 1896, and uh, he was a Renaissance man. You don't hear about people like this anymore. He spoke 10 languages. He studied music and art. Yes.
Wow.
And he went to medical school. And then he got malaria and had to drop out. And for some reason at that time, they didn't let you come back online. So he completed an art degree. Let me pull this up. What did he do? He completed his studies were in biology, medicine, cytology, microscopy, and he had an interest in physical medicine. His wife, Estrid, was a naturopath back in the day. And I just think so. Also, I'm a board certified pelvic health specialist, and I got that back in about 2009 when it was women's health specialist. So I'm very attuned to gender health, um, and one of the things I find fascinating is you cannot find anything on Estrid.
Well, I was going to say for her to get a degree way back when, that was a big deal. She had to be smart. She had to be, a
Yeah.
little tough cookie.
But it was all him, and I'm sure she was a powerhouse behind him.
Right. Yeah,
I
yeah.
don't know. Um, so he did get a PhD from Brussels in art history, and he went on and he worked for the Copenhagen Royal Danish Nautical Charts Archive for 6 years, drawing maps.
Oh,
So if we think of the arterial system, the venous system, the veins, and the lymphatic system, he was just tuned into, these pathways, right? Always looking at these pathways from a very artistic perspective. And that tapping into creativity allows for inspiration. That was, you know, E equals MC squared person,
right, 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 right.
Einstein,
Einstein. Yeah.
right? These are flashes of inspiration. And so he and Estrid moved to the south of France. He was developing this technique, and they opened up a clinic, a wellness clinic down there. And they were helping Englishmen with sinus infections. And, for a little, let's see, then also interesting to me that technique was, as it was developing, fascism was growing in Europe, right? So it's around in the 30s and then 1930s. And then with the outbreak of the war, he went back to Austria. I think for a while he interacted with Dr. Foldy. So, so if you look at the Foldy technique, it looks like Vodder, but their emphasis was more on lymphedema. They treat lymphedema. The Dr. Vodder method, we use it for lymphedema, but it was not started for that purpose. It was started for wellness, and it has tremendous applications in non-lymphedema situations.
So when he was working with the sailors or whatever he was working with back then in his clinic before the war,
Yeah.
was he was doing some of this lymphatic work?
Yes, he's creating the method and helping people with sinus infections. Probably, I don't know all the story, but um, for instance, he had a protocol that was you needed 18 treatments in a row, and we don't do that anymore. And
Right.
I'm
Was
gonna
that every day?
Yeah,
Okay.
yes. Eight,
Okay.
and there is something that we do now called combined decongestive therapy, where you do manual lymph drainage, bandaging, and exercise, and you do that daily. And when I first learned this stuff, so I certified in um, 98, I believe it was 1998. Sometimes I'd treat people for 6 weeks. um, you can't do that anymore under insurance.
Oh yeah. No.
I
Yeah.
can get 2 weeks out of insurance,
I
which
remember
Mhm.
years and years ago, I was like, wow, talking to the physical therapist, and they're like, oh yeah, they're limiting us to, 12 visits, 15 visits. And I'm like, wow, for the year. And recently I'm talking to the physical therapist and they're like, yeah, they're giving us 6 visits, 8 visits. I'm like, you gotta be kidding me. So
it's
yeah, the
not.
insurance companies are strangleholding some of that. Yeah.
They are fundamentally changing the practice of medicine, of physical therapy. I don't know what else, but um, warning to the public because they're we're not getting as good a care as we
Exactly.
want
Or you
to.
can't get the results that you used to get when it's like, hey, you need to come in this many times and people don't really want to pay because they're like, well, I have my insurance. Okay, but your
Yeah,
insurance is only going to give you 8 visits, you know? Yeah.
yeah, yeah. And I think when they started squeezing physical therapy at first, that's where you saw massage therapy take off. Because physical therapists work with their hands, that was a part of what we do. Nowadays, it's they do a lot more just
A lot of
exercise.
exercises. Yeah. Yeah.
Yes, because you can see more people doing exercise than the one-on-one care. And then the next thing I'm seeing is personal training, stepping up and filling the gap of one-on-one care that physical therapy should be giving, but can't afford to give if you want to use your insurance. You
Right.
know,
Right. Yes.
unfortunately. Um, so I plan and am working towards more and more cash. I think about 25% of my business is cash, so that if people want that sequential care, they can get it.
Then they can get it without an issue. Yes.
Yeah.
Yes.
Um,
So he used to do, so 18, you're going over 2 weeks
mhm.
of daily care.
Yes.
Wow, I could see somebody could get improvement with that.
Um,
Sure.
Oh, it's wonderful. I wish I could do more with it, but I was just at the advanced body class that Kobe Blanchfield developed, and that is post-op plastic surgery. So it was a 4-day class. I got treated twice a day for 4 days because we were practicing on each other. I felt so good. It like took away some back pain I was having. I had more energy. Um, I, and I'm like, I'm going to be offering this to people. I'm just going to tell them, here it is. Because with lymphatic drainage, what you're doing is you're decongesting the tissues. This is why it's helpful to so many things, because it's helping a, a fundamental function in your body to, clean out the plumbing.
Right. All right. So let me ask you this. If you had to explain this to someone who's never had lymphatic drainage, treatment or session or whatever, what would a person expect when they come in to get a lymphatic? It's, from my understanding, it's lighter work. It's not real deep. But I don't know if it can be. I don't know if it, so I don't know. So what would someone expect if they were going to come in and get
Okay.
a treatment?
So when I came back from my first training, I realized most people know nothing about their lymphatic system. I didn't know. Even going through physical therapy school, I thought, oh, yeah, there's lymph nodes. I never realized that there were lymph vessels. So normally what I do is I begin by explaining the lymphatic system and how it works, starting as these open-ended sinuses that are tethered to the tissues by anchoring filaments. And so small stretches open those sinuses, and the interstitial fluid and waste can come into that system. It becomes larger and larger vessels until you can finally visualize it, like the thoracic duct. It runs right along the aorta through the rib cage. And so, I have pictures and I explain this, this anatomy. Um, the lymphatics are everywhere in the body. And when I teach the medical theory, this is one of the, like, almost my trick question, because I think I didn't know for at least 10 years that it's everywhere in the body, even though I was trained. It
Right.
just doesn't sit in, because the technique is a skin technique. And the reason it is a skin technique is because the if I stimulate part of the system, the entire system is going to work more. Um, so the lymphatics are concentrated in the tissues that interface with the environment. So the skin, the lungs, and the digestive tract have a higher amount of lymphatic um, structure than the other tissues of the body. And so if I just work lightly on the skin in a rhythmic pattern, it's going to be much more calming. So it has a Sunjung. Oh no, I'm not going to remember his name. This is a South Korean teacher. He did a research study demonstrating how this has calming effect on the autonomic nervous system. We say it's sympatholytic. It quiets the sympathetic signaling. So that's Like we can all take pause and go, wow, that's big, especially today in our society where even our entertainment is geared towards upping the sympathetic signal, right?
Right. Yeah. Fight or flight. And yeah.
hmm I will tell you, it is hard to convince some people that light is what they what is going to be beneficial. Um, because deep tissue, right? Like people want that deep tissue. They want that, well, they want to feel it. Um, so I might have to work with those people to help, but um, a the way that this technique is taught, there are not, I should be able to say this off the top of my head, but there's a sequence for the neck, the face, the chest, the abdomen, the legs, the arms, the back, and the buttocks. And so these are like learning scales. Okay. And this is where the technique has dropped off in popularity, okay? Because the original um, training was a month of training. You spend 5 days learning these basic techniques. Now we have it down to 4 because they put the theory online.
Oh,
But
okay. Okay.
yeah. And then in the second week, you learn clinical reasoning and application of these techniques in problem situations. And there are some special techniques that are like for joints, for intraoral, that sort of thing. And then the last 2 weeks focus on lymphedema and bandaging and combined decongestive therapy and that in-depth 16 hours of medical theory. Um, so, but that initial learning these sequences, learning these scales is what a lot of schools in the US have gotten away from. So um, if you look at the research by Heuchenreuter and Brummer, done in the 90s, 80s and 90s, they demonstrated that this technique was effective. Um, they the fine, and then in the fast schools came in, get trained in lymphedema management in 5 business days. They even have one now that's a weekend. So the 5 business days are a 9-day course, 10 hours a day in a row. It's sort of a dancing with the stars of lymph drainage. The first day is normal and the rest is a problem. And so people look really good off the shoot, but they cannot maintain it. And in the Vodder School, they are so detailed. Think of the reputation of Austrians and Germans is very concise, right? And that's how they are. That's how they are in teaching this technique. Um, they want you to memorize these sequences. There's 4 hand strokes that you perfect. And even one of these fast schools recently said, oh, you really only need stationary circles. And if you get to know these other strokes, you are cutting off some very effective technique, but it takes time to do it well.
Right. So,
Yeah.
so with the 4 different types of strokes, can you
hmm
use any of those 4 on any of those sections? It just depends on what's going on with the person.
Yeah. So when I'm teaching, what I do, I bring out this video I have of, so I know when I have to come up with names on the spot. The lady who was in, um, just in Wicked, who played Elphaba.
I haven't seen it, but yes.
Oh my gosh. Well, you've got to go see it. So, this lady is fantastic singer, and it's going to come to me. But anyway, there's
Ariana Grande?
no, it's the
Okay.
other one.
The other
It's
one. Okay.
the other one. And she's a I have this video of her riffing on a song, and she's doing all these scales as she riffs. you cannot do that unless you have practiced, you know?
Right.
So this is in her back pocket. She doesn't even have to think of it, and then she can pull it out and be creative with it. And that's what I try to get across to my students. Practice these techniques. And then when you step in with that individual, there is going to be something that you do that you will have never done before because that individual is like no other that you have seen before. And that's what I want the level of skill to become for the therapists, not applying protocol. But
Yes, yes.
yeah, but they
So
have to start with that protocol.
exactly, yes. So if someone comes in, so I assume this is not done through the clothes, or is it?
Generally, no, but it could be. Like it's not going to work on jeans. It's not going to work on multiple layers. I have this heavy sweater on. I wouldn't, well, see, I can even do some there, but it's best done on skin. But
Okay.
it um
Do
you
you
know,
need oils and creams?
no,
Or no?
no,
So no oils and creams.
no.
Okay, so
Don't
this
you?
is just done.
Yeah. Okay. So the in the course of my learning, um, when I got my master's in orthopedic manual therapy, I really thought I knew everything. No, I'm so smart. I'm joking. I'm joking. And then a friend of mine went to John Barnes's MFR class, and she came back and helped a patient I could not help. And now I was told that those techniques were foolish. And I was blown away. I'm like, I need to know what these are. So I went and I learned myofascial release, upledger craniosacral, and baral visceral manipulation to the advanced degree. I assist visceral classes. Um, and what I took away was we are all talking about the same thing, uh, fascia and fluid.
Right.
And
Yeah, yeah.
I invented a word. It's senus therapeutics. It means awareness arising out of bodily sensation. And there are methods within body work, within psychology, within movement that do this. But they all sell themselves like this is it. This is the winner. This is going to heal you. So when we talk pressures, like I mentioned, it's a light pressure, but the pressure it's the pressure that's required to stretch the skin, which in the case of fibrosis or swelling, it might be a heavier pressure, right?
Okay.
Just like in these other fascial methods, like when you learn craniosacral, they start you out at 5 grams, but in advanced craniosacral, you are meeting the tissue with the pressure it needs. And sometimes that can be quite heavy.
Gotcha. Okay.
So people are getting lost in the teaching pressures. And so Vodder technique gets written off like, oh, they're just light. It's like, no, that is where you have to start to learn this. And then you need to learn to listen to the tissues with your hands. That's a Barral, Jean-Pierre Barral term, to listen. It's a wonderful term we should all borrow and use, is that we're listening to the body and what it needs. Um, yeah. So,
So if we were to look at the classes, because we had
yeah.
discussed this earlier. So the level one is gonna be that intro, you're getting in, you're learning the four or five different things. That's all kind of lighter
And
work,
you're learning sequences and you have to memorize.
learning the sequences. So is it like going over the body like a pattern?
Yes.
Okay,
So if
so you
we
do this.
remember,
Okay.
yeah, you remember Emil Vodder and his charting maps. He has you go in a sequence of drainage, of lymphatic drainage in that area of the body.
Okay, so if a person comes in, do you do all the portions or is it just what the person needs? So somebody can come in and just get, the abdominal region done or
Yeah, it would just be the portion that they need.
Because that would take some time. You couldn't do. Can you do the whole body in a single session, or is that kind of hard to do?
I have never done the whole body in a
Okay,
single session.
okay,
Yeah.
because that
I
would
think
take too
that would
long
be a long time and it could be overwhelming.
for the body. Yeah,
Yeah.
yeah. Okay,
Yeah.
okay. So so we have a level one class where you learn the different areas and then the initial pressures, and then you go into a level two. I think it was a level two.
Yeah.
Well, it says level one practical,
Yeah.
which you have to get out of. Then you can go into a level two and a level three.
Yes.
And so that's
So
where I assume you're getting now meeting the tissue with what it needs in those.
yes. So level two is more like orthopedic, um, more a, a a normal system with a disease process, a normal lymphatic system with some kind of injury, like
Okay, yeah.
whiplash. It's very good for whiplash. Level three is for a changed system. Something has happened to the lymphatic system. Um,
Okay.
so something is, in order for swelling to be called lymphedema, there has to be a mechanical change to the system, which can happen with just even a knee surgery. But like I have somebody right now with a lymphedema caused by back surgery.
So would it be from an injury or something like that for
It
that
could
level
be.
three?
Yes, like I had somebody with a crush injury that developed lymphedema after that.
Okay.
So there's damage to the lymphatic structure, and that makes it lymphedema.
Damage to
So back back the original intent was that you took level one, level two, and level three, but that process can take a couple of years. And a lot of people are like, hey, I want to start treating lymphedema now. So in the United States, in order to stay uh, relevant as a school, the Wittlinger Clinic and the Dr. Vodder School in Austria approved allowing people to go from level one to level three and skip level two. And it's driving the teachers crazy because you don't have good hand skills. You haven't practiced. It's um, uh, like I said,
gotcha.
I looked at, am I jumping on a dying horse, by wanting to teach this? And I went looking and I pulled out the research. And if you look at athletics, at music, at dance, you can't short circuit any of that stuff. You have to do your practices. And somehow, in selling manual therapies, we have jumped on this idea that, oh, you take a weekend course and you can do anything with this technique when you go back to work on Monday. And people don't want to take the course unless they can hear that. And so I think I that people can take the level one information and do good jobs with the sequences on Monday. But if they want to master this technique and truly help people, be willing to put the time in that it takes to get good at kinesthetic skills, you
Right, and
know?
that's what I always say is, you can watch something be done. Like you can watch somebody change the oil on the car, but until you actually get in and get your hands dirty, you haven't really learned how to do it because something's going to come up and you're like, how do I do this?
Yeah,
And so and that's the same thing with all the hands-on techniques. You got to put the time in. And the more you do it, the easier it becomes, the more you learn, that whole thing
the better you get.
the better
I'm a
you get. And
Yeah,
so this goes from level one, you can go level one to level three, but then you
yeah.
have to take level two because you have to have level one, two, and three before it looks like before you can get into even more advanced stuff.
No, you can I mean, they're trying to make it so people will take the classes and they will feel like they can use it. So you can go level one, level three. That's all you would have to do. The other thing is the Dr. Vodder School doesn't keep adding extra classes. Their goal is to teach Dr. Vodder's method and have people do it well. So there aren't add-on classes except for the advanced neck and face and the advanced body class. And that is to answer people's questions for how to help manage post-op plastic surgery, because that is something that wasn't around when Dr. Vodder was teaching. The level of plastic
Gotcha.
surgery that is right now, it is nuts. Talk about it's just escalating, escalating, escalating. Um, uh, and so people want more guidance. I think after level 3, you know how to handle post-op, but this just gives people another chance to talk more about the procedures, what they are, and practice talk how you would apply the technique afterward. Um,
Gotcha. So if
yeah.
somebody comes in for a treatment, how long is a normal session, a normal treatment session?
45 minutes, even to an hour and a half.
Okay,
My,
so it just kind of varies. Kind of depends
yeah,
on what they're getting done,
what the need is.
what the
Yeah.
need is. Okay.
And frankly, it's driven by insurance, what they will,
Well, I was just going to say,
affordability.
ideally, it would be if they could come in Monday through Friday and Monday through Friday, or Monday through Saturday, Monday through Saturday. That would be an ideal for the person to get better.
In some situations, yeah. We kind of fall into once a week.
Okay.
And then if somebody has a situation where daily treatment would help, I recommend that. And so for my lymphedema patients, I really recommend that they get intensive treatment once a year,
And intensive is daily.
daily.
And
But
so
yeah.
so when somebody first comes in, they could start the recommendation would be like, hey, come in once a week
Hmm.
for 6 weeks, 8 weeks, 10 weeks.
Yeah. Okay. So I'm, it depends on what your population is. And my population are people with problems. Okay. And with, I mentioned at the beginning chronic problems, these difficult patients. Who are these difficult patients? um, so a lymphedema patient, my first goal with them is that we develop the skills of being able to take care of themselves. And then one of the tools is intensive treatment. But I can do this intensive treatment, and if they don't have the skills to take care of themselves at home, the problem can just come back.
Okay, right.
Right? It's like diabetes. You don't go in, okay, you've taken your insulin for 2 weeks, now you're good.
Yeah.
Right? There's some things you need to know how to do. And lymphedema is a chronic condition. And actually lots of things that are going to end up with the lymphatic system being um, overwhelmed, it's going to require um, that skills development. So that's uh, what I saw, what I was seeing was like constipation. Um, I'd have to go back and look at my thing. A lack of self-care skills. Um, in chronic inflammation conditions, hormone dysregulations, uh, the post-viral syndrome. That's a big one. We were treating post-viral syndrome long ago, probably from the time Dr. Vodder started. Post-viral syndrome has been a part of being human. And so, COVID just put it in our face.
Right.
Um, so anyway, I have people then, once we establish home care and then they decide to come in at a regular basis, that can be anywhere from once a week to once a month. But so I have people who have seen me for like over a decade, 10 and 15 years, which is sort of unheard of, right? Like if I was kind of given the impression as a new grad that if I'm doing a good job, I can tell them everything they need to know in those 6 visits and they're gone, right? And now I'm much more like, you know what? This is medicine. And there's nothing wrong with taking this medicine on a regular basis. Like we're helping veterans. Um, and who I have somebody who had a diagnosis of MS, and she is backed out of that diagnosis. You, I've known her for over 20 years, and she's followed me, and she's been dogged about coming in once a week for 20 years. And I, you know, the only this is what she's been doing is manual lymph drainage. So I think the potential for this technique is amazing, um, and so underutilized and appreciated. This this is the number one referred modality in Europe.
In
Um,
Europe, but what about here in the States?
right.
Right? It's a little bit different. So how many different versions? Because you've mentioned there's
Okay.
other classes, right? There's other
Other schools.
techniques, other schools, other things.
Yeah.
Um, so they have different variations, I'm assuming, of the way that you're going to be, manipulating the motions, or are all of them pretty similar with a basic one, at least one? Because you
A
said
lot
one.
of them, there's the Casely Smith that comes out of Europe that uses a lot of long stroking methods. Casely Smith. There's a Godoy out of South America, and they've done a lot of publishing to support their work. I think that is a more heavy-handed technique.
Okay.
And then the other ones, like the Chickley method, Foldy method, they are using Dr. Vodder's patterns and renaming them, and do so. What's the other one? The ACOLS, American College of Lymphology. I think that was the Chickley method kind of blended into there. So they're claiming that you can feel the rhythm of the lymphatic system, which I do believe over time I've come to recognize that. But if you think of the difficulty of this skill, starting people out feeling the rhythm it's just too many variables. So we don't teach that. Um,
So you can't come in on Saturday morning and by Saturday afternoon after lunch, you're like, got it. I can feel that
I
rhythm,
feel it.
right?
And it's like the craniosacral rhythm or the rhythm of the organs. Um, some days I really can feel it and some days I can't. And that's me. That's like an indicator of I need to be taking better care of myself today because apparently I'm not getting. Um,
But that's all of us. We all have a good day and a bad day, right?
yeah,
That's
yeah.
everybody.
So there are these other techniques. Um,
So there's quite a few then. There's quite a few variations, I guess, of lymphatic work. But it
yes,
all but it all started with Dr. Vodder.
yeah.
Okay.
And unfortunately, so then they started doing the fast trainings. Lo and behold, by the research in about 2012, it started showing that manual lymph drainage didn't work. And and now you're getting studies with the indocyanine green um, and functional MRI, and they can see the movement of lymph, and they go, oh, it's not working. So some of our teachers are trying to publish. They've just published a case study. I should find it, um, showing that it does work. What Dr. Vodder was teaching does work. But when you do these quick trainings, when you're doing it heavy-handedly, it's not going to work. And unfortunately, that's killing the method. Um,
Right. And
so
so that's what's so good about the Vodder method is you're trying to keep it a little bit more pristine and
yeah.
go through the,
And
the process. Yes. I
they're
like
not
that.
interested in adding. You watch these schools, and they all start imitating each other. What was it? Strain, counter strain, that started adding visceral courses and this course instead of staying with the purity of the work and teaching that well, you know? And so Dr. Vodder's school is committed to just teaching this well and not
Right.
expanding. And then go to your system or go to these other classes and let those experts teach that. We don't need to teach them.
Right, right. I like that. I like that. Now, I was on the website and it looks like there's an app.
Yeah.
Is that new? Is that a new app or is that
Um, Grace started that
like
a few years
recently?
ago, like in the last 3, 4 years, I
Oh,
think.
okay. So
Three.
3 or 4 years. Okay. I
Yeah.
I uh I thought I had gotten on the website, maybe 6 or 8 months ago, and I don't recall seeing that. So, but that's,
Okay.
me. That's me. So
She's been trying to improve the website, so maybe her website's getting better too.
that's right. That's right. So
Um,
so with the app, my question is, first of all, does it have like videos in it? Is it like a teaching type of thing, to help with the a treatment or, what?
It is, you can find a therapist on the app. You can find the classes. They've got some videos with Robert Harris um, talking about the method. They've got, um, she's trying to make it easy to get to registration and information about um, the different courses and therapists and what exactly the technique is. It's got some exercise videos on it. Um,
So it's
yeah.
good for you could get that app and then say, is there somebody near me
Yes.
that could
Yeah.
that could treat me?
And in the Dr. Vodder method, you'll notice that there's those update classes. So every 2 to 3 years, therapists need to attend these updates to have their hands checked. And so they may have taken the training, but if they do not go to the updates, they don't, their names are not on there.
Right, then
That's
they lose the certification. Yes.
Yeah, that's how stringent they are.
And I agree with that because then you don't want to send somebody and say, hey, go get some of Dr. Vodder's work, and they're not even doing lymphatic work anymore. And that's why they didn't come back to the class in 3 years or whatever. So,
The the
and that happens.
teachers
Yeah.
the teachers used to have to get together every year and demonstrate to each other. And now we get together every other year, and every fourth year we have to go to Austria.
Wow.
Yeah.
And Austria pays for the trip?
No.
Wouldn't that be nice?
Yeah. It's a beautiful place to visit though, but
I can imagine. I can imagine in the summertime, right?
yeah.
Yeah. Otherwise, lots of snow. Um, all right, and I think we talked about because another thing that I saw was an esthetician training program. What
Yes.
that's something separate? You can go in just for that? Is that or do you
Yeah,
need
so
first?
yeah, so people who are estheticians, they can learn this technique, especially the neck and face is emphasized for
So
that.
it's just a class just for that.
Hmm.
Yeah, just an okay. All right. Nice.
Yeah, I'll tell you right now, in the US, there are 3 teachers for that's it. There's Kathy, who teaches all the way to level 3. Jamaica Bigger, who is in California, she's teaching level 1, and myself. And I teach level 1 in theory. And there's someone in training right now. Um,
Now, do you
but
guys travel or do people have to come to you for the classes?
um, that we travel, and my goal, I want to teach 5 of these classes in by next May, so that I can start training to teach the level 2. And like, I don't want to age out before I get all this done. But I'm want to learn to teach it here in the US. So I have a class coming up in Madison, Wisconsin. I've it's sort of my retirement plan. I have my family in Wisconsin, so if I teach there, I can I can see my family and teach. So that's and then
Which is
I
good. Yeah.
yeah, and then Seattle and Bellingham I hope to set up a class because I have family there. And then I've held my first class here in my town, and then I'll probably do another one here. But I just want to pepper, first of all, the Pacific Northwest where I am with excellent lymphatic drainage. I want people to know that if they're getting good care so that, I think I got another good 15, 20 years in me, but we need this technique. We need everybody doing it, and it's such a great thing to bring in even with your other techniques. So I use it a lot with my, you know,
Oh, that's a good point is you can use this in combination with another technique.
absolutely. I was listening to you about your technique and like so if you can have a nerve that has swelling around it. And so just a few of these strokes can help clear the area and
Nice.
then bring your method in further. And that's what I do with the methods that I've learned.
Right. Yeah, yeah, yeah. Oh, that's good. That's good.
Yeah, I have been working with the fascial sheaths. And so personally, I've been developing some techniques because I do a lot of visceral manipulation using lymph drainage of the deep fascial sheaths and getting some good results. But I don't have research on it. But I have started to share that and teach on topics, like application for pelvic congestion syndrome. That yeah,
Which is
that's
important. Yeah.
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 So
Very nice.
mhm.
I got to tell you, I learned a lot about lymphatic drainage and stuff today. So that was really good. So I really appreciate you coming on here and sharing your expertise here because that was good. That was a lot of good information.
I love chatting. Thank
That's
you. Having
right. If you made it this far, smile.